Okay, we are recording.
Great. Good morning, everybody. Thank you so much for coming and for accommodating the date change. We were shy of a quorum last time, and we were shy of a quorum the meeting before, so we would have been 3 sets of minutes behind for approval. So I thought it best to postpone. We have a quorum now, so at this point, Elise, would you mind calling the roll?
Sure. We
Thanks.
have Christine Weston.
But Christine's going to be joining us late. She's at the PCA waiver hearing.
Yes. William Seals.
I'm here.
Thank you. Margie Durando Marquette.
Yes, here.
Kelly Kendall.
Here.
Aaron Levitt Smith.
Here.
Thank you. Barbara Cass. Commissioner Porter.
Here.
Jessica Rival. Lisa Rivers. Michael Santoro.
Present and accounted for.
Thank you. Laura Watson. Good morning, everyone. Thank you.
Hey, thanks, Elise. I appreciate it. Okay, so today is the bulk of our agenda is going to be our annual legislative update, where we recap some of the highlights of the legislative session as they relate to long-term services and supports. This was very successful session for the long-term services and supports space. A lot of good legislation was passed. I have asked the state long-term care ombudsman, Marie Painter, to join us today, since so much of what was passed she had a hand in, and it affects our home and community-based services, our nursing facilities. So she will be joining us. Good morning, Marie, to give an update. Those of you who are at the Long-Term Care Advisory Council meeting, if you attended as a member of the public, some of this might sound familiar. And then Elise Pearson, who those of you who weren't in attendance at our March meeting, Elise is new to OPM. She has joined our unit. She will be staffing this committee ongoing. And this was Elise's first year tracking legislation and putting together the annual legislative update for this group. So after Maureen's presentation, she's going to then highlight some of the other bills we wanted to raise to your attention. And then we will open it up for comment if any of you have bills that we didn't touch upon that you would like to discuss with the group. As in previous years, our legislative update is written. It will be posted on the website immediately following this meeting. And it's long this year. It's 14 pages long, but it's all good stuff. Elise will not be going through all 14 pages. She will just hit the highlights after Marie does her presentation. And as I said, then we'll open it up to the group. Also, just wanted to let everyone know that CTN is broadcasting today's meeting. So as always, if you could just stay muted when not speaking, and then when you do speak, if you wouldn't mind, please just stating your name, that would be extremely helpful. Once Christine Weston joins us, I also, from the Department of Social Services, I will introduce her more formally. But she is the new DSS appointee to the Long-Term Care Planning Committee. She recently accepted the position as director of Community Options at the Department of Social Services. So we had Amy Dumont filling in as an interim. And we thank Amy for her time and service on the Long-Term Care Planning Committee. And we are very pleased that Christine will be joining us as the permanent DSS representative. And it is Christine and her team who will be doing the September rebalancing roundup that we do every year. So with that, I would like to turn it over to Marie to kick us off in our legislative update.
Good morning, everybody. So yes, it was a very busy year, and we were able to move forward a lot of the ideas and concepts that we hoped to pass this session. So I'll review 2 bills basically, and then there were some other ideas that moved forward in other ways that we'll cover that really do impact and help support individuals who are older adults in our communities and individuals with disabilities. So as part of House Bill 5001 or Public Act 2439, sections 1 through 3 address home care provider registry, and this is to help promote awareness and facilitate provider recruitment and retention and support state oversight of providers, and to give information about names and job titles and training through the Department of Social Services and their website to individuals, greater awareness to the public. And a lot of the information that they're making public is for greater awareness. Quality of care links, again, connecting to the Center for Medicare and Medicare's Compare website, online tools to make, again, those comparisons when looking at long-term care facilities and nursing homes, quality of care. And that will be through the Department of Social Services and the Department of Public Health to make it easier for the public to access those sites and compare different facilities and homes. Identification requirements. So for individuals who are receiving home care services and homemaker companion agency services, that when they come out to your house, that they'll be wearing badges with their names on them. Skip down. Presumptive eligibility is in there. I think DSS will probably speak about that, but we are very excited that that moved forward. Ombudsman notification of assisted living service licensure. So when the Department of Public Health, when their commissioner receives notification that there is a new assisted living service in a managed residential community, that my office will receive notification of that so that we can ensure that we are supporting the individuals that live there and providing them information about their rights. And that when there's a change in service of providers in that setting, that the individuals living there get the information to understand who is providing them with the services and that there's been a change in their service provider. A little bit of a change in the way that the duties for the individuals in my office can be used so that we're able to best support the individuals in our state that have the greatest need at the time. So if there is if there's a nursing home closure or a change in demand, that I have the flexibility to be able to support the people in our state and use the resources in my office as needed. And then sections 22 through 23 address ombudsman consent. And that's the way that we get permission to work on a case from an individual. And we changed those to match the federal rules so that individuals who use visual auxiliary aids, different types of support in order to communicate with us, that we can take that kind of consent from them. Initiatives for excellence in nursing homes. So these centers for excellence and the program that would be developed to move forward with the nursing homes in partnership, I'm very excited about this because I think it'll really highlight the good quality care that we have going on in nursing homes and try to promote what we see going well and encourage other nursing homes to take these practices on and to see what their peers are doing and support that in other homes. And so that's something I'm actually really excited about. And as we move forward with that, taking that information, and later in this bill, there's information about a consumer dashboard. So we're looking at a center for excellence and then a consumer dashboard where people will be able to take that information and make an informed decision about where they're receiving their long-term services and supports. I think that's really important. I'm not sure how many other states have that, but to be able to know that when you're making the decision about where you're going to be going to receive your care, if it is in a long-term care facility, that you'll have a lot of up-to-date information from the providers in your state, and that it's from the Department of Public Health and Department of Social Services with input from my office. The next bill is House Bill 5046, which resulted in Public Act 24141. So nursing home room capacity limitations, this was really important to us. In some nursing homes, individuals share rooms with 3 to 4 people, and that by 2026, people will have the ability to be in rooms with 1 or 2 people. And this was very intentional, especially after COVID, with infection control and the need for dignity and privacy. And we thought that this was really important. There was a lot of support from the governor's office, OPM, DPH, DSS, and the legislature, that people felt that it was necessary to support individuals living in nursing homes and their need for privacy and dignity. We had a lot of support around this. There was a lot of discussion in the need to also support the nursing homes, and DSS gave that support for the financial responsibility around making sure that they were whole, and they're going to support them in that way as well. Nursing home waiting list and transfer. So nursing homes, when it comes to their waiting list, making sure that if there is a nursing home closure or an emergency, that as people need to transfer into those homes, that it's done responsibly, but that they're able to accept individuals into the homes that they want to go to, that it's close to their loved ones, that individuals are accepted even if they're on Medicaid, and that our office is able to look at that and ensure that people are accepted appropriately. All right, manage residential communities. We were able to pass some legislation, and we worked with the industry and other advocates prior to session to look at what was needed in order to give protections to people moving in related to information, and to receive 90-day notices related to fee increases, prorated or full refunds of certain fees if they can't meet the residents' needs within the first 45 days of occupancy. And then other needs related to housing and participation in federal programs and state programs. For the assisted living programs, also disclosure of increase to their care plans and what that will look like. Basically making sure that you're fully informed of any changes in finances and that you can request that when you're moving in for up to 3 years looking back. Also, the establishment of a work group to study the impact of prohibiting nursing homes from placing newly admitted residents into rooms with more than 2 beds. For Senate Bill 1, Section 28 addresses looking at loneliness and fostering social engagement, and a working group that must include at least 2 residents of assisted living and 1 facility for veterans to look at that in a suburban facility. It also establishes a definition of direct care. This was really important to us because we wanted to ensure that when we're looking at direct care and what that means, that it's individuals who are helping you day to day, giving you care in your room for bathing, dressing, toileting, feeding, and transferring. And not that those are the only things that a nursing home needs to be paid for, but that when we're looking at where money goes, that we're having the same conversation, that we need to know what money is going to indirect care and what money is going to direct care, so that we're all speaking the same language and having the same understanding when we're having the description of where money is going. All right. And then in sections 38 and 39 makes it discriminatory practice under CHRO for laws for nursing homes to refuse applications for admission solely based on an individual receiving mental health services at any time. And that's really important to us to make sure that people have inclusive access to long-term services and supports, even if they've needed to have support to seek mental wellness in the past. Is that something that many of us have had to do over the course of our span of life? Electronic wait lists. So the wait lists historically have been like big bankers books that have been hard for us to keep track of, and honestly for the nursing homes to keep up with. So now that they'll be able to be kept electronically, they'll still need to ensure that they're maintaining them in a way that can't be tampered with and that our office has access to, but that they'll be able to do that electronically. Non-discrimination in order of admission, and detailed application process. So they'll need to detail that out ahead of time so that you'll understand what that looks like. Management of the wait list, how that looks and allows for removal of unresponsive applicants, so that if you don't get back to them and say that you want to be maintained on the wait list, that they can remove your name, and the transparency of that communication. And then HB 5308 regards absentee voting rights for individuals in nursing homes. Again, really important that individuals in nursing homes have access to voting, what that looks like. And our office works with the nursing homes to ensure that residents have that ability to vote while they're in the nursing home, and we'll continue to work with them on that and their right to do absentee ballot in the homes, and what that looks like. So we'll continue to work with them on that. And this just ensures that they continue to have that, and how it addresses their name, their address, the category of the designee per this subsection, and the delivery of that tasks are assigned to them or their designee. I think that is it for our sections. The other sections I'll let the other agencies cover, but it was, as Melissa said, it was a very active year, and we were excited about everything we were able to pass. And I want to thank our partners in that for all the work that they did as well.
Thanks, Mairead. I really appreciate you taking the time to do that wrap up for us. It was an excellent summary and a lot of good work on behalf of your office to get a lot of this done. And, again, a successful session overall. We are not in our legislative update going to touch on SB1 or HB 5001 again, because Mairead did a very thorough job. But are there any provisions in either of those bills that any of the agencies would like to comment on before we move forward with the rest of the summary? Or any questions for Mairead? No? All right, great. Thanks, Mairead. Appreciate it. Elise, would you like to kick us off? She's going to just point out some of the bills that maybe didn't get as much of the fanfare during session. And then again, I have the full legislative update will be posted immediately following the meeting. So go ahead, Elise.
Okay, thank you. We have I guess I'll start with Special Act 24-4, an act concerning the efficiency of the Department of Social Services in determining eligibility for medical assistance and responding to requests for information or assistance. This bill requires the Commissioner of the Department of Social Services to do the following. It's to conduct a study on eligibility determinations for medical assistance and responding to telephonic request for information or assistance, measuring the times for those phone calls, and reporting back that information come July 2026. Special Act 24-5, an act concerning homelessness. The Commissioner of Social Services, along with the Commissioners of Housing and Mental Health, Mental Health and Addiction Services, look to conduct studies and develop a strategic plan, to improve outcomes for participants of the Connecticut Housing Engagement and Support Services, the CHESS program. Public Act 24-46, an act establishing a property tax exemption for veterans who have a service-connected permanent and total disability rating. This bill fully exempts from property tax, primary residence, or motor vehicle for each former member of the armed services who has a permanent and total disability rating, referred to as the P&T rating. Public Act 24-58, an act implementing task force recommendations for wheelchair repair. This bill sets requirements related to wheelchair repair for authorized wheelchair dealers and establishes a complaint process and reporting mechanism through the Office of the Healthcare Advocate. It also restricts prior authorization and new prescription requirements for customized wheelchair repair under Medicaid and complex rehabilitation technology, also known as CRT, wheelchair repair under private insurance plans. It also establishes a CRT and wheelchair repair advisory council to monitor wheelchair repair and make recommendations on improving repair times. Public Act 24-68, an act concerning various revisions to public health statutes, specifically focusing in on Sections 36, the homemaker companion agencies. The transition plan deadline has been extended from August 24th to December 1st of 2024. And I'm sorry, I think I might have said August 1st, 24. I meant August 1st, 2024. Public Act 24-99, an act implementing task force recommendations for elderly nutrition program. This bill makes various changes to the elderly nutrition program's funding and administration, including coordination with the Supplemental Nutrition Assistance Program, also known as SNAP. Specifically, Department of Aging and Disability Services is going to work with the appropriate AAAs, contracting with ADS to use half of its initial round of funding under a contract. ADS will require the AAAs to develop a continuity of efforts to plan and minimize program benefits disruptions. They'll also develop a plan to streamline the program's contracting process related to compliance reporting and eligibility and assessment forms. The Department of Social Services and ADS will also work alongside with the contracted AAAs on the elderly nutrition program services. And request information on whether a person's eligible for the elderly nutrition program and receiving SNAP benefits. DSS in consultation with ADS to develop a plan to maximize SNAP benefits to support the elderly nutrition program as well. And I apologize if I'm not doing a good justice of summarizing that one, but I'm sure the two representing will be able to shed some more light on that. Public Act 24-122, an act concerning the Department of Developmental Services recommendations regarding various revisions to developmental services statutes. Section 3 identifies, there's many changes, but specifically what we found for this committee, pertinent to this committee, were Section 3, Supportive Housing Assistance Program. This bill transfers to the Department of Housing Commissioner the responsibility to provide assistance under the program in consultation with DDS Commissioner and make related conforming changes. Section 4-6, DDS Self-Advocate Coordinators. This allows CDS to employ and increase the amount that self-advocate coordinators that can be employed. Sections 7-8 and 15, resident transfers. By law, the DDS commissioner may assign someone with an intellectual disability to a public or state-supported private residential facility. This bill removes the specific requirements that the commissioner consider the recommendations of a properly designated diagnostic agency before making these assignments. Updates and revises the law of transfers between these residential facilities, allows for a post-transfer rather than prior notice, and creates a process for temporary emergency transfers. Also, specifies that for all transfers, including those for emergencies or medical reasons, adult residents of these facilities or residents' legal representatives have the right to request a hearing if they object to the transfer. Section 9-11, the Human Rights Program Review Committee, it codifies existing practices that DDS has, that each region, including the Southbury Training School, will have a Human Rights Review Committee. And it's just making it now it's establishing it in law. Section 12, Abuse and Neglect Registry. By law, DDS maintains a registry for certain former employees who left or were fired from their jobs because of substantiated abuse or neglect complaints against them. These people who are employed by DDS or an agency, organization, or person DDS licenses or funds. This information is available only to certain agencies. It's now available on the registry to the Office of Labor Relations for determining whether an applicant for employment with certain state agencies appears on the registry. Specifically, this applies to applicants at DDS or the Department of Children and Families, Mental Health and Addiction Services, Social Services. Section 13, the Ombuds Office specifically identifies DDS as ombuds as an office in legal terms. Section 14, ICF, IDD, con-related notices. This bylaw, long-term care facilities, including Medicaid certified ICF IIDs, generally must seek certificate of need approval from DSS before certain activities such as introducing new services or eliminating services. In several cases, the law requires the facility to give related notices to certain other state entities. And lastly, I'm sorry, Melissa, did you want me to review? I believe you did. No, you were going to do that. I'm sorry. I'll leave
That's
that for
okay.
Melissa.
Thanks, Elise.
Thank
That's
you.
a good first shout out. She joined us in the middle of session, and this was her first pass at putting together our update. So thanks, Elise. Great job. So the last bill we just wanted to touch on, it was actually Senate resolution and Senate Resolution 7 and House Resolution 9, which were the resolutions proposing approval of a memorandum of agreement between the PCA Workforce Council and the New England Healthcare Employees Union, District 1199, SEIU. So our office oversees the labor contract. Our office chairs the PCA Workforce Council and oversees and administers the labor contract between the council and 1199 SEIU. And for those who aren't familiar, the group of employees that is being represented in this group by SEIU are those personal care attendants that are hired through the state's Medicaid self-directed programs. So the PCA Workforce Council was established to represent the Medicaid consumer and the state Medicaid agencies. The Medicaid consumer, in the case of these self-directed programs, serves as the legal employer of record. They hire, fire, train, manage their team of personal care attendants, and they are provided with individualized Medicaid budgets that they use to reimburse their personal care attendants. And the state has a contract with the fiscal intermediary that then serves as the payroll agent on behalf of the Medicaid consumer to actually manage the budget and issue the payroll based on timesheets submitted. So the labor contract, this is the fourth labor contract that we have entered into. This group of workers is unique because they basically represent the employers represent over 8,000 individual businesses. And then their workers are a group of 15,000 workers that are employed by these 8,000 individual consumer employers. And they unionized back in 2012 under 1199. Under this contract, their minimum wage increases to $20 an hour. effective upon execution. So right now, PCAs are making $20 an hour. They will get increments through every 6 months, flexing between $1.50 in every January and July. The contract ends June 30th of 2026, at which time personal care attendants minimum wage will be set at $23, have reached $23 an hour. In addition, for the first time ever, because of we are hearing out in the community about workforce shortages and the need to recruit and retain good workers for our consumers in the Medicaid programs, and the consumers themselves had said, please help us recruit and retain. We need to have a well-paid, well-trained, high-quality workforce to that end to help encourage longevity. For the first time ever under this contract, we PCAs who stay with the same consumer employer for a 2-year period, that period being April 1, 2024 through March 31st of 2026, will receive a longevity bonus. So that bonus will be based on the number of hours the PCA works for the same consumer employer, because these are each consumer's its own business. So everything is calculated per consumer. So they can earn, if they work under 20 hours a week annualized, then they get a $400 bonus at the end of that period. And if they work 20 or more hours, they are eligible to receive an $800 bonus. And that bonus can be received for each individual for whom they work. In other words, if they provide services to work for multiple consumers who are self-directing their services, and they can earn that longevity bonus under each. We also have increased paid time off, so workers can earn up to 50 hours a year of paid time off. They can carry that over up to a maximum of being able to accrue no greater than 100 hours in any given year. And we have also provided a subsidy to help individuals purchase, cover their health care costs. And the subsidy is calculated at 7% of annual earnings. They get the subsidy again, that's calculated on earnings per consumer employer. So they can get multiple of these stipends. And this is an increase. It used to be 6%. It's now 7% of wages, up to a maximum of $5,000 a year. And what we have found is that is enough for most people to be able to afford the annual premium on the health insurance exchange and secure insurance, or to utilize the funds to pay out-of-pocket costs that might arise when they need medical care. So those are the highlights of the collective bargaining agreement this time around. It's been unique getting to implement a new collective bargaining agreement while onboarding a new fiscal intermediary at the same time. Allied and Sunset Shores are no longer serving the population. A new contract has been awarded to the fiscal intermediary, GT Independence, who we are working with to implement as much as DSS and DDS are working to work with them in all their programs. We're also involved in helping to implement the collective bargaining agreement and make sure all the terms are met. If anybody, not everyone on this call would be interested in a deep dive into the collective bargaining agreement, so I won't get into all the nitty-gritty. If you do want more information, the full agreement and a summary of each section of the collective bargaining agreement that Elise put together is posted on the PCA Workforce Council webpage, and I'll throw that up in the chat for everybody as well. So I feel like we just talked a lot at you. Before we move on, do the agencies have any questions or anything you want to add that perhaps we didn't touch upon in this year's, verbally touch upon in this year's summary? Okay, quiet group today. So with that, then we'll move to the next section of the agenda, which is our standing item to receive a brief update on the potential development of a multi-sector plan on aging and disability. And today, to provide that update, I think Margie is flying solo because Alyssa couldn't join us. So Margie, I turn it over to you.
Sure, thanks, Melissa. So glad to see this on the agenda again and happy to provide an update. And actually, I can do a quick review too, since it's been a while. So for a little review, a small team in Connecticut was part of a one-year multi-state learning collaborative through the Center for Healthcare Strategies. And our team was exploring developing a multi-sector plan for aging and disability in Connecticut. And besides myself, our team included representatives from the Connecticut Age-Well Collaborative, DSS, OPM, the Commission on Women, Children, Seniors, Equity, and Opportunity, and the Connecticut Council on Developmental Disabilities. And the Learning Collaborative gave us access to other states who were developing and implementing their plans, as well as technical assistance on how to facilitate a coordinated process in Connecticut to develop our own multi-sector plan. So the collaborative just wrapped up its year-long process. So that piece is over, but we are still connected to this group so we can continue to receive updates, and our work definitely continues, which I'll talk a little bit about. But just as a refresher, a multi-sector plan for aging and disability is a valuable roadmap that helps transform policy, infrastructure, and service coordination for our growing aging population and people with disabilities. So a multi-sector plan is a cross-sector strategic planning resource, and it's a whole government effort. All state agencies can look at how their policies and planning impact older adults and persons with disabilities. And it brings together stakeholders to outline a clear framework for addressing the needs of older adults, people with disabilities, and family caregivers. So there are some broad goals of an MPA that I mentioned during our previous meeting. I feel like it's worth repeating. It provides a framework to plan for 10 years. It transforms infrastructure. It incorporates an aging and disability lens across state priorities in planning. I really feel like that's an important point. And also very important, reflects extensive input from community and values lived experiences. It improves coordination of services and ensures ongoing accountability and evaluation. So in Connecticut, our approach has really been to learn how other states have approached developing and implementing their plans, looking at their best practices, their investments in this process, and their outcomes. We want to connect with other state agencies across our state government, as well as stakeholders, including those at the local level, to seek support. And also from the beginning of our planning process, we want to include disability in our plan, not just aging, and we want to include stakeholders, especially at the community level. So we want to formalize the multi-sector plan process in Connecticut with the needed support so that we can begin our plan development. So we went through the year of exploring, and now we want to formalize this and begin our plan development. But just a couple of updates from other states across the country. Many states are in various stages of exploring and developing and implementing their multi-sector plans. We have a few updated stats since our last meeting on progress around the country. 10 states now have an executive order. 6 have legislation. 5 have some other form of statement or proclamation from their leadership. And in terms of investments in this process, we recently learned that 8 states have or plan to have funding to support their MPA, and they are most commonly receiving their funding from the state budget, ARPA funds, and in-kind support from external partners. Excuse me. And something new this month, the Federal Administration for Community Living has released their strategic framework for a national plan on aging. So as we're looking across state agencies within Connecticut and our local partners, ACL through its interagency coordinating committee convened leaders across 16 federal agencies and departments to develop a strategic framework. So this committee is charged with developing a national set of recommendations on key issues. And the first step in the creation of a strategic framework for the first step is the creation of a strategic framework for a national plan on aging. So this is exciting that it's happening at the federal level. And the framework report that they just came out with outlines the approach they're going to take nationally to prepare for the future. It's really the first step in the development of a national plan on aging to improve the experience of aging in America. So this committee acknowledges in their report to Congress that the work has already begun with several states already implementing plans that prepare for the future of aging, and many states have begun developing similar plans, and they're talking about the multi-sector plan. So it feels like things are starting to really come together. And then just for next steps, we'll continue our research, and we're going to continue to reach out to our partners, including all of you. We're ready to bring the multi-sector plan to Connecticut. We have some important meetings coming up to further discuss and formalize this. We want to discuss what support, commitment, and investments look like in our process so we can move forward with the development of a multi-sector plan. And I'm happy to provide another update at the next meeting as well. And I also wanted to just put that national framework in the chat if I can get that in there just so people have that, since that's new since our last time. Okay, and Melissa, I have an update on a quick update on our unit, but let me know when you're ready for that.
Okay, great. Thanks. I appreciate it. Thanks so much. Before we move on, does anyone have any questions for Margie on the status of the development of the multi-sector plan? No. I believe that Christine Weston has joined us. Christine, are you here? She said she was. Okay, there she is. So Christine, I already gave you an introduction at the beginning of the meeting, but since you're finally here, and I know you're toggling between the PCA public hearing and trying to be in two places at once. So I just wanted to formally, while you were here, welcome you to the Long-Term Care Planning Committee. And we're very glad that you're able to join us. And if you're able, you can say hi. If you have poor connectivity over at the LOB, I understand.
Yeah, I'm actually back in DSS. I'm almost at my desk. You almost got me back at my desk.
That was quick.
So can
Okay.
you hear me? Okay. Yes.
Yes. Sorry.
You can hear me okay? So
Yes.
hi, I'm Christine Weston with DSS and the Director of Community Options now for DSS. Very excited to join this group. I remember years ago presenting to this group as a staff member, so very excited to be here and work with all of you in my capacity. So been listening in. Margie's very exciting things going on, and just eager to learn all the great work that we're doing.
Great. Thanks so much, Christine. Okay, so with that, we now move on to member updates. So Margie, I know you have one, so go ahead and you can provide your unit update.
Melissa. So first of all, our unit has had a name change. We were called the State Unit on Aging, and now we're called the Bureau of Aging. And this aligns with the Bureau structure within our Department of Aging and Disability Services. So I wanted to share that and also explain that for those of you who are seeing us calling ourselves the Bureau of Aging. And also, we released our Bureau's draft 3-year state plan on aging for review and comment. And Melissa, thank you for sending Commissioner Porter's request for comments out to everyone a few weeks ago. So the comments were due yesterday so that they could be included in the final plan. So right now we're reviewing comments and we'll be finalizing our plan, and that is due to the Federal Administration for Community Living on July 1st. So that's my update, and I didn't know if Commissioner Porter had anything to add to that. No? Okay. Good. Thanks, Melissa.
Thanks, Margie. So at this time, I open it up to other members. Does anyone else have an update they would like to share? No? Okay. The one thing I do need to loop us back around to do, I think we have a much fuller house now. I would like to just have someone make a motion. We have 2 sets of minutes to approve. I'm going to start with December 12th, 2023. Those were sent out with the agenda for this meeting. Would someone be good enough to make a motion to approve the meeting minutes from December 12th, 2023?
This is Amy Porter. I can, yep. So moved. Or second.
Okay. So Amy made the motion. Aaron, did you second?
I will second, yes.
Okay, great. Aaron Levitt Smith second. All in favor?
Aye.
Aye.
Okay. Any nays? Abstentions? Okay, not seeing any. The minutes from December 12th passed. And now I need to ask that we repeat that exercise for the March 12th, 2024 meeting minutes.
So
So
moved.
moved. Oops, I'll second.
Okay. Okay, so Aaron Levitt Smith made the motion. Michael Santoro second. All in favor?
Aye.
Any opposed? And abstentions?
Amy Porter, I'm going to abstain. I wasn't at that meeting. I believe I
Okay.
wasn't at that meeting.
Great. So all in favor, please say aye.
Aye.
Okay. Oh, we already did that, but you did it again and you did great even the second time. So thank you. The minutes from March 12th, 2024 are approved. And at this time, I know Michael Werner, chair of the Long-Term Care Advisory Council, would usually join us to give a few comments. He's traveling today, so he couldn't be here. I am going to put in the chat the link to the recording of the June 13th Long-Term Care Advisory Council meeting. It was an excellent meeting, so I encourage folks to take a watch, listen to the discussion. And I think Christy Colville, did I see you? Do you have any comments you would like to make?
Hi, good morning, everyone. Thank you. Yeah, Michael indicated he was traveling. I just wanted to share that one of the bills that we talked about at the Long-Term Care Advisory Council was Senate Bill 307, which was the coverage for biomarker testing, which was our lead priority this year, which is a really important piece of legislation for folks to get this coverage. As we know, we're in the new era of treatment. There is a current treatment for Alzheimer's disease in the early stage. There is another one that is pending, which is looking very good. So we're really excited about this. And I just wanted to make sure that members on today's call were aware of that. And Michael, I know, provided a good summary. So thank you so much.
Great. Thank you for sharing that with us. I appreciate it. All right. At this time, I'm going to ask, is there any other business? Okay, seeing none, is there a motion to adjourn?
So moved.
Okay, thank you. This group never wants to leave. I don't.
Sometimes it's hard to get to your microphone or unmute button in time.
Okay, so Aaron made the motion to adjourn. Second.
Second.
Michael second. Okay, 10:51, we're adjourned. At least you can stop recording. Thanks, everybody. I hope you have a wonderful rest of the summer. We'll see you in September.
Thank you.
Thanks.